Dr. Marty Fenstersheib, County of Santa Clara Testing and Vaccine Officer. We will begin the press conference in English and American Sign Language. We will then transition into question and answer section. After that, we will move into statements from the podium in Spanish, Chinese, Tagalog, and Vietnamese. Without any further ado, I welcome to the podium Dr. Sara Cody.
Good morning, everyone. Thank you for being here. I'm Sara Cody, the Health Officer and Public Health Director here in Santa Clara County. We're here today. We want to make an announcement and share with the public regarding what we're finding in terms of the variants of concern, the SARS-CoV-2 variants of concern. These are strains of the virus that have emerged in various places in the world, and we have now documented are circulating here in our county. So all three, or actually all four of the variants of concern as they've been defined by the Centers for Disease Control and Prevention are here in Santa Clara County. We've had the variant B117 from the United Kingdom circulating here for some time, and then the numbers reported to us are beginning to pick up. This variant it spreads more easily, it's more transmissible as compared to the regular SARS-CoV-2 virus. We also have had a handful of cases of the South African variant and one report of P1, which was the variant that was first identified both in Brazil and Japan. So this is important to know because we've documented them, the numbers are beginning to pick up, and right now we're in a race between the variants and the vaccine. We have some data regarding the variants and how effective the vaccine is, some but not all. But the top line message is you are far more protected if you're vaccinated than if you're not. And the more people that are vaccinated in our county and in our community, the safer we all are. So what does this mean? This means that we're back in a bit of a precarious place as far as our collective ability to curb this pandemic. It is spring. It is a beautiful day. We all have cabin fever. We all want to get out. We all want to get back to our lives. But we can't do that quite yet. We can't do that quite yet. So I'm calling on every one of us to continue to wear our masks whenever with anyone outside of our household. That includes people who are vaccinated. Okay? I also urge everyone, please don't travel unless you really have to. We're not quite there yet. We've got to give it just a little bit more time. Some people have to travel, go ahead, but wear your mask and make sure that when you come back to the county that you quarantine, that you stay away from others. So with that, I'm going to turn it over to Dr. Fenstersheib, who will give a quick update on the vaccine supply and vaccination here in our county.
Thank you, Dr. Cody. Good morning, everyone. So we did get our notification of what we will be getting for next week, what will be arriving next week for our vaccines. And it's the total number, which is not including Kaiser or Palo Alto Medical Foundation, is 71,900 doses. How does this compare with last week? Last week we got just over 58,000 doses. So we did get an increase this week, which is good. Most of the increase that the state got, which again was passed on to us, was for the Johnson & Johnson vaccine. So that's good because that's the one shot and done situation. You get one shot and you're finished. So we're happy to see that we got more vaccine. However, it's still not enough. We're doing about 1/3 of our capacity in this county. So we continue to need more vaccine, but we're happy to see at least a little bit of an increase. When we look at our dashboard to see how we're doing in this community, about a little more than a third of residents that are eligible, those are 16 and older, have been vaccinated with at least one dose. So that's good. Those that completed the whole series are about 20%. So 1 in 5 people are totally done with the series of vaccine. But as Dr. Cody mentioned, we really need to get people vaccinated. We know that there is a limiting factor of how much vaccine we have. So again, people need to just continue to check all of the websites and make sure that when it is your turn, that you find an appointment and get vaccinated. Today, April 1st, opened up the vaccine eligibility yet again to include 50 years of age and older. So that will be added to all of our eligibility at the clinics. That equals a lot of people. I think I mentioned at one time previously that it was about 370,000 more people, but probably a little less because some of those people already fit into some of the other categories. But still adding a lot of people that we don't have vaccine for now. So please, everyone, be patient. And as Dr. Cody said, please protect yourself because we do not want the variants to cause a problem with people that have not yet been vaccinated or even develop additional variants, because the more the vaccine, the more that the virus is allowed to replicate, the more chance there is for additional mutations and additional variants. So again, be patient, continue to check the website, our website, sccfreevax.org, and you'll find an appointment hopefully, if not next week, in the next couple of weeks. We are told that the vaccine supply should increase by the middle or end of April and well into May for sure. Thank you.
We'll now open up for questions in English. Please identify your questions for. We will call on everyone individually. We'll start with KCBS.
So this is a race between the variants and the vaccine, because the more opportunity that the virus has to circulate, the more opportunity it has to take on mutations and to change. So we've already seen a few variants of concern emerge, and what we want to do is get our population here and really globally to get vaccinated as quickly as possible to reduce that opportunity.
NBC, what's the question? What about Cody and what about the Fenstersheib? Are we on the verge of headed backward if this continues, going back to more restrictions? If we don't, social distance, wear a mask, go out.
The trends that we're seeing here in Santa Clara County are somewhat similar to the trends in our Bay Area region. And that is after really good progress and consistent declines in positivity rates and case rates since the first week in January, we are now seeing our case rates flatten, and in some cases some indication that they're beginning to tick up. So we may have gotten as low as we're going to go. We're about where we were last October, mid-October. And as you will remember, after mid-October, starting early November, our case rates started to tick up quite precipitously. So unfortunately, we still all need to be very aware and very cautious to prevent any surge or even a swell. We don't want that to happen.
And for Dr. Fenstersheib, I'm certain that there's obvious frustration for people who can't make an appointment. Some are looking at Fresno, see if they can get it in Fresno. They're asking why open it up to 50 and over when we can't even supply 65 and over right now. I just answered that question.
Right, so the question is, why are we opening up even more when we can't meet the needs? It's a good question, and we're taking the lead, excuse me, in the direction from the state. So that was not our decision, that was the state's decision. Excuse me. I wanted to make just add one more thing, because I mentioned 71,900 doses. Of those, about 49,000 are first doses. So all second doses were covered, and we have less that we needed to do for next week. So there will be at least 49,000 doses of vaccine that will be opened up for appointments for next week, which is more than we've had in the past. And I wanted to make that very clear.
Casey, do you?
Question for Dr. Cody. Can you tell us why you say it's important for people to wear masks when everyone's been vaccinated and groups of people that have been vaccinated, even if I guess it says that's different from the CDC guidance?
So the question is, why is it important to wear a mask even if you've been vaccinated? The reason why it's important to keep wearing a mask is because not everyone has been vaccinated. The proportion of people who've been vaccinated is not near the level of herd immunity. So that's number one. Number two, while being vaccinated provides excellent protection against severe illness and death for those who are vaccinated, it's not 100%. No vaccine is. So wearing a mask gets you, really close to perfect protection. And it still protects others. While most people who are vaccinated, the evidence is that you're very unlikely to spread the virus, it's not zero. And given that these variants are spreading, we really want to do everything we can to keep them from spreading. And if everyone continues to wear their mask, that will really help these variants from getting a foothold. Thanks.
City News.
The question is the vaccine less effective for these variants of concern? The answer is this is still under study. There are two types of data that we are collectively looking at. One is laboratory data, and there's some evidence from laboratory data that some of the vaccines may not perform as well with these variants. But more importantly, there's what happens in real life when there's people who are vaccinated in a community where the variant is circulating. Those data are obviously fairly incomplete, but still coming in.
Carolyn.
Two quick questions. One, is there any evidence that the number of people that have been vaccinated has had an impact on overall cases so far? And second question, has there been any long-term conversations about booster shots to deal with the variants?
The first question is, have vaccinations had an impact on case rates? And the second question is, what about booster shots? So we've seen significant declines in case rates and positivity rates across the state, the region, and our county. This has to do with, I think, both increase in natural immunity. A lot of people got infected, and we have increasing vaccination rates. So I think it's both. There is conversation around booster shots. Our best guess is that SARS-CoV-2 may require, annual booster shots, something akin to getting your annual flu shot. We all may need to get our annual SARS-CoV-2 shot.
KPIX.
So this is a question for Dr. Cody. If one of the existing variants or one that emerges later kind of defeats the vaccine, aren't we essentially back at square one?
The question is, if one of these variants defeats the vaccine, aren't we back at square one? So I would say the good news is that we have a variety of vaccines. Each of them work a little bit differently and may provide, too soon to tell, but different levels of protection. The key is, though, to overall tamp down the spread of the virus. And if we tamp down the spread of the virus, it will help everyone, right? It will help everyone. That's the key.
Just a follow-up for Dr. Fenstersheib. So I was looking at actually a map of the Bay Area with vaccination rates by county. There are other counties led by Marin that have half of the folks who are vaccinated. Why has there been such a lag in Santa Clara County
So why is there what you observed as a lag in this county as opposed to some other counties? I don't think there is a lag. We are using all of the vaccine that we are allocated. So as I mentioned, we are only at 1/3 capacity. So as we get the vaccine, we are getting it out, at least the data looking at our county system, we are utilizing our capacity 99% of what the vaccine is allocated to our community. So it's not an issue here, it's an issue of what we receive. And we have a big population here, and we're also focusing on our equity and our underserved population. So we're using everything that we get, and as we get more, we'll increase it even more.
I don't think there's been any suggestion that you're sitting on existing doses, but other counties are further ahead. I mean, what's the explanation?
I think it's a supply issue, and so we're a county of nearly 2 million people, the largest in Northern California, and so the allocations are not going as far in our county as others. But again, as more is received, we will quickly increase that from that 35% on up in getting everyone done.
The question is around testing. We are seeing a little bit of a slump in testing. The rates of testing are drifting down. They're drifting down faster statewide than they are in the county, but this still is an area of concern. So the question is, when should you be tested? Let's not forget that testing is a really important strategy to prevent transmission of COVID. So if you are working somewhere where you have frequent exposure to the public, you have frequent exposure to others, you should get tested regularly. How regularly depends on how much exposure you have, but once a week would be fantastic, and it should be at minimum once a month. Second, if you are exposed to someone who has COVID, you need to quarantine immediately and then get tested around day 7 is what we recommend. And if you have any symptoms of COVID, you should get tested. So we still have widespread testing available. There's plenty of access. There should be no barrier to getting tested. And if anyone has questions, you can look on our website, sccfreetest.org, and find out where you can get tested. The question is, do I anticipate there will be another surge? Unfortunately, if we can't get more vaccine supply, and if we can't get continued adherence to behavior change like masks, we do anticipate that we'll have another surge. I would hope that it would be a swell, not a surge. I think vaccines are going to help, but we need more supply so we can get it out faster. And we need people to just hold on for a little bit longer. Keep wearing your mask, delay your travel, don't indoor dine, don't go to indoor bars, don't host an indoor gathering at your home. Even if it's allowed under the state rules, don't do it. It's not safe, not yet. I think of a surge as large and a swell as mild.
So do I think the county will reach its goal of at least 85% by August? I do. I'm optimistic that the production numbers are going up. And again, the vaccine will be flowing probably to a lot of our local pharmacies, also directly from the feds, and to our federally qualified health centers also. So vaccine should be coming in from a number of places. And I think by the time we reach the midsummer, we'll be where we need to be. Right, so what percentage of Santa Clara County has been vaccinated? So we look at two things. We look at least one dose, and that for 16 years of age and older, those are the eligible criteria, and that is about 34%. So a third of our county. that has had at least one dose. And if you look at how many of all of those of our entire county have completed the whole dose series, either 2 Moderna, 2 Pfizer, and 1 Johnson & Johnson, it's 20%. So 1 in 5 are totally completed in their dose.
Caroline?
There was some reporting yesterday that Johnson & Johnson was having some disruptions in supply. Is that trickle down to us all here?
Yeah, so is there a problem with the supply and production in Johnson & Johnson? We don't know that. The state did get a very large amount of Johnson & Johnson allocated for next week, over 500,000 doses, and we don't know yet whether that problem at the production line is going to affect us into the future.
For Dr. Cody. Doctor, the state hasn't changed anything in terms of the guidelines in regard to traveling yet, and yet travel is definitely ticking up. Can you just elaborate more on why people need to hold off?
The question is around travel and why people need to hold off. So there still is a travel advisory that the state has discouraging non-essential travel, discouraging travel for pleasure, for example, discouraging travel for spring break, for example. The reason why we discourage travel is that travel exposes people who live in one area, go to another area, may pick up a new variant or a new strain and bring it back and then mix and things take off. I would say that our county historically, just because of the demographic mix, people have family from around the world, people have work that takes them many different places, we tend to see unusual infectious diseases emerge in our county. So it is really especially important that we pay attention and not travel right now. If someone does travel because they have to, it's essential, we urge people to 1, wear masks consistently, and 2, quarantine when you come back. That means you come back and you stay in your residence for 10 days.
Final question, KPIX.
Yeah, across the Bay Area, we've gone pretty quickly from purple to red, orange, some looking like yellow, maybe in some of the weeks. It's my understanding that you've always had the authority to sort of enact restrictions tighter than what was recommended by the state. If you're concerned about surge or swell, any chance that you will put the brakes on what any further reopening there are?
This question is around state and local restrictions and whether we would consider something local if there is a surge or a swell. The answer to your question is very complicated. As we know, the larger a population that makes a change, the more effective it is. And so as the pandemic wears on, it becomes more and more difficult to do something locally that is more restrictive than surrounding counties and than the state. However, my job, whether I like it or not, is to do what I think will best protect the health of people living in our county.
Is that a maybe or a yes? Or too soon to tell?
That's a too soon to tell.
Thank you, everyone. Appreciate it. Thank you, Dr. Cody and Fenstersheib.
All right, that concludes our English and American Sign Language portion of the press conference. We will now be moving into the Spanish statement from the podium. Muy buenas tardes, mi nombre es Ricardo Romero-Morales, soy oficial principal de información pública para el Condado de Santa Clara. El día de hoy, los funcionarios de salud pública del Condado de Santa Clara continúan viendo aumentos en el número y proporción de casos confirmados de variantes de COVID-19, lo que indica que el progreso de la región en la reducción de la pandemia sigue siendo precario. Por lo tanto, le estamos pidiendo a toda nuestra comunidad que por favor siga usando su cubrebocas, manteniendo ese distanciamiento social y poniéndose la vacuna cuando sea su turno. También les queremos pedir que por favor no viajen. Si tienen que viajar, háganlo con precaución. Ahorita, en estos momentos, viaje que es de placer, en estos momentos solamente no es recomendable. Solamente si es necesario viajar, hágalo, pero hágalo con mucha precaución. Hasta el momento lo que sabemos es que hasta la semana pasada, hasta el día 27 de marzo, hemos recibido al menos 2 casos de la nueva variante de Nueva York y también hemos confirmado al menos 92 casos de la primera variante que se identificó en el Reino Unido. También hemos identificado 3 casos de la variante sudafricana y 1 caso de la variante que se originó en Brasil y más de 1000 casos de la variante de California. También lo que sabemos es de que ya el Estado anunció cuántas vacunas vamos a estar recibiendo para la siguiente semana. En la próxima semana tenemos aproximadamente 71.900 vacunas que estamos recibiendo de parte del Estado. De esas 71.900 vacunas, aproximadamente 48.000 a 49.000 vacunas serán designadas a primeras citas, a primeras dosis. Así que estaremos abriendo nuevas citas muy próximamente. Les estamos pidiendo por favor a la comunidad que vaya a nuestra página web sccvacuna.org para que pueda agendar una cita. También puede llamar al 211 para que una operadora o un operador le pueda asistir en hacer su cita. Es muy importante recordar que si usted ya se vacunó, aún tiene que seguir usando su cubrebocas. La importancia de esto es que no toda la gente, no todos los miembros de nuestra comunidad han estado vacunados hasta este momento. Aún tenemos la escasez de vacunas y es por ello que le pedimos a la población que por favor use su cubrebocas, mantenga ese distanciamiento social y que se ponga la vacuna cuando es su turno. A partir del día de hoy, las personas que tienen 50 años o mayores ya son elegibles para recibir la vacuna contra el COVID-19. Después de abril 15, todas las personas quienes tienen 16 años o más podrán ser elegibles para recibir su vacuna contra el COVID-19. Una vez más, solamente para recordarle a la comunidad que por favor use su cubrebocas, mantenga ese distanciamiento de más de 6 pies y por favor vacúnese cuando sea su turno. Gracias. And that concludes our Spanish portion. We will now move into Vietnamese from the podium. So I welcome Lee Vo to provide a statement in Vietnamese. Thank you.
Kính thưa quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Kính thưa quý vị, các viên chức y tế hạt Santa Clara tiếp tục nhận thấy sự gia tăng của các biến thể mới COVID-19, cho thấy rằng tình hình dịch bệnh vẫn còn đang trong giai đoạn đáng lo ngại. Các viên chức khuyến cáo các cư dân trong quận hạt không nên đi chơi xa, không nên đi du lịch và đi ra đường vì những cái hoạt động không thiết yếu để hạn chế được tối đa cái trường hợp là mình sẽ bị lây lan nhanh chóng. Nếu như mà quý vị đi du lịch, hãy cách ly mình tại nhà sau khi đi du lịch trở về và luôn áp dụng các biện pháp phòng ngừa COVID-19 như là mang khẩu trang, giữ khoảng cách an toàn và luôn luôn rửa tay. Tính đến tuần trước thì chúng ta ở trong quận hạt Santa Clara đã phát hiện ra thêm nhiều cái biến thể mới đang lưu hành ở trong quận hạt và chúng tôi cũng đang như quý vị cũng biết thì mình cũng đang phải đối mặt với cái sự thiếu hụt về vaccine. Thành ra là trong khi mà mình có nhiều vaccine hơn đi đến trong cộng đồng thì chúng tôi vẫn muốn là mình hãy cùng hợp tác với nhau, cùng nhau giữ cái khoảng cách an toàn và cùng nhau hạn chế được cái sự lây lan ở mức tối đa để khi mà chúng ta có thể mở rộng được cái nguồn vaccine, nguồn cung cấp vaccine và những người trong cộng đồng có thể nhiều người được đi chủng ngừa hơn thì từ lúc đó thì mình hãy bắt đầu đi ra tham gia những cái hoạt động thoải mái hơn. Thì với sự gia tăng của các biến thể xảy ra khi mà quận hạt Santa Clara tiếp tục đối mặt với nguồn cung cấp vaccine không đủ thì số lượng liều thuốc được phân bổ vẫn không đủ trong tuần qua. Với sự phân bổ của tuần này thì cho phép khoảng 35.000 cuộc hẹn tiêm vaccine liều đầu tiên. tính đủ điều kiện, có nghĩa là những người mà hồi đủ điều kiện thì bắt đầu từ ngày hôm nay sẽ được mở rộng cho những người từ 50 tuổi trở lên, và bắt đầu từ ngày 15 tháng 4 thì chúng tôi sẽ mở rộng cái tiêm chủng này cho những người từ 16 tuổi trở lên. Chúng tôi sẽ cố gắng đưa ra các cuộc hẹn sớm nhất có thể khi mà nguồn thuốc cung cấp thuốc chủng ngừa cho phép, để quý vị có thể đi đặt hẹn và đi chủng ngừa sớm nhất để cho cộng đồng của mình có thể được miễn nhiễm. Thì trong cái quá trình này chúng tôi vẫn luôn muốn nhắc nhở quý vị là như mình cũng nghe được những cái tin tức là đã có những người bị nhiễm, là đã tiêm vaccine rồi nhưng mà vẫn có cơ hội được nhiễm, đúng không? Thì như mình cũng biết thì cái tỷ lệ mà bảo vệ của vaccine đó nó chỉ tới cao nhất là 95% thôi cho Pfizer, thì có nghĩa là còn 5% còn lại mình vẫn có cơ hội bị nhiễm COVID-19, mặc dù là mình không có bị bệnh nặng đi chăng nữa, nhưng mà cái cơ hội bị nhiễm đó mình cũng có thể một phần nào đó có thể lây lan cho những cái người khác, và khi mà mình đi du lịch, mình đi travel đó thì nó cũng có thể lây lan cho những cái cộng đồng khác nữa. Thành ra là chúng tôi vẫn luôn khuyến khích quý vị là vẫn phải đi xét nghiệm thường xuyên, mình nên đi xét nghiệm thường xuyên, bởi vì cái việc xét nghiệm đó là cái cách mà hiệu quả nhất có thể giúp cho quý vị phát hiện được ra là mình có bị nhiễm COVID-19 hay không. Từ đó mình mới có thể ngăn chặn được cái sự lây lan. Thì chúng tôi có rất là nhiều cái địa điểm xét nghiệm được mở ra trong cộng đồng. Nhưng mà trong tuần này, thứ Bảy vào ngày 3 tháng 4 thì chúng tôi có cái địa điểm xét nghiệm ở tại Grand Century Mall vào lúc 10 giờ sáng đến 6 giờ chiều. Thì quý vị hãy đến cái địa điểm này vào thứ Bảy ngày 3 tháng 4 từ 10 giờ sáng đến 6 giờ chiều để quý vị có thể được xét nghiệm bằng tại cái xe bus lưu động tại Grand Century Mall nha quý vị. Kính chúc quý vị thật nhiều sức khỏe. Xin cảm ơn. And now we moving to Chinese statement.
大家好，我是圣塔克拉拉县紧急行动中心的 Chang， 在此宣布重要的新冠讯息。圣塔克拉拉县持续在社区中发现确认的新冠变异病毒株的病例，并且有持续攀升的迹象，显示大流行还在继续，疫情仍然严峻。县府呼吁民众避免出行，如果出行返回后，请自我检疫。基因序列的测试确示了全国性的疫情走向，更能准确地判断此趋势在我们社区中的攀升，而我们也看到了全美各地确诊病例的激增，可能和变异病毒株有关，这些都是警讯。但是好消息是，只要我们继续坚持防疫的措施，我们还是可以阻止疫情在社区中的攀升。虽然在今天，加州政府扩展疫苗的资格到50岁以上的民众，而在4月15日更扩展到16岁以上的居民，疫苗量的不足影响了我们能够为这些民众施打疫苗的能力。所以在等待更多人接受疫苗的同时，请大家保持耐心，继续防疫不松懈，勤洗手、戴口罩，并与他人保持6英尺的距离。没有必要的时候，请不要出行。如果感到生病，请在家检疫，并且预约去做新冠的检测。提醒您，就算目前橘色风险等级下有更多的活动行业开放，但是不表示是安全的，请大家谨慎行事。任何消息与更新，请上圣县的网站 www.sccgov.org/covid19， 可以选择中文的页面。更多疫苗的讯息或者是登记打疫苗，可以上圣县的疫苗网页 sccfreevax.org。最后，祝大家平安健康。Now Jim Bill will be providing a statement in Tagalog. Thank you.
Magandang umaga mga kaibigan. Ako po si Jim Bill Batuampo, Public Information Officer ng Santa Clara County. Ang mga kumpirmadong kaso ng mga variant ng COVID-19 ay patuloy na dumadami sa Santa Clara County. Ang mga opisyal ng pampublikong pangkalusugan sa Santa Clara County ay patuloy na nakakita ng pagtaas sa bilang ng mga kumpirmadong kaso ng mga variant ng COVID-19. Naghuhudyat na ang pag-unlad ng rehiyon sa pandemya ay nananatiling hindi tiyak.
Sa gayon, ang mga residente ng county ay hinihikayat na umiwas sa pagbiyahe, mag-kwarantina kung bumibiyahe, at palaging gumamit ng mga panakip sa mukha. Habang maliit na bilang lamang ang mga positibong specimen ng COVID-19 ang sumasailalim sa genomic sequencing, ang bilang ng mga kaso na nauugnay sa mga mas lalong kumakalat na variant ay sapat na dumadami para humudyat ng nakakabahalang trend. Ang pagdami ng variant ay nangyari habang ang Santa Clara County ay patuloy na nahaharap sa hindi sapat na supply ng bakuna. Ang bilang ng mga inilaan na doses ay nananatiling sa parehong bilang sa mga nakalipas na ilang linggo, na ang inilaan sa linggong ito ay pumapayag ng mahigit kumulang sa 35,000 na mga appointment para sa unang doses. Sa paglawak ng kwalifikasyon ngayon para sa may edad 50 at pataas, at sa April 15 sa mga nasa edad 16 at pataas, mas maraming doses ang kailangan para mabakunahan ang mga naghihintay sa pila, lalo na ang mga membro ng komunidad na lubos na naapektuhan ng pandemya. Samantala, ang lahat ay dapat magpatuloy ng mga pamamaraan sa pagpigil na dati nang napatunayan na lubos na epektibo laban sa COVID-19. Ang lahat ng pagbibiyahe ay mariing hindi hinihikayat, at kung may bumibiyahe, sila ay hinihikayat na magkwarantina sa kanilang pagbalik. Ang mga membro ng komunidad ay dapat na magpatuloy sa pagsusuot ng maskara, magpanatili ng pisikal na distansya, magpanatili ng mga aktibidad sa labas kaysa sa loob, at magpabakuna kapag pagkakataon na nila. Ang mga opisyal sa kalusugan ng county ay nagpapaalala sa publiko na kahit na ang karamihan sa mga aktibidad ay pinapayagan sa ngayon, marami sa kanila ay may mataas na panganib at hindi inirekomenda, at nanatiling mahalaga para sa komunidad na bawasan ang pagkakalantad. Ang impormasyon tungkol sa kwalifikasyon at pamamahagi ng bakuna ay makikita sa sccfreevax.org. Maraming salamat.